Hello, everybody. This is Essential Care. I'm Gula Dashevsky. Today, we are going to go over our online enrollment platform, Connect4Medicare. This is one of the free benefits that Essential Care provides to agents who are contracted with Medicare insurance companies through Essential Care as their general agency. It is provided to you at no cost. So today, we'll talk about how to log in, some general ideas how to utilize the system. Let's go ahead and start. This is how the website looks like. But let's go and start from the beginning. You just type connect4medicare.com and it will take you to this page. Click on 2021 Connecture. It will take you to the login page for Connect4Medicare. All the agents who are contracted through us, they have username and password. If you don't have your username and password, please give us a call. We'll provide you with it. So you need this in order to utilize the system. I have the username and password put in right here, so I'll just go ahead and log in. Connect4Medicare is only an enrollment platform for Medicare Advantage, Supplement, and Part D plans. So it is an enrollment site, and it shows all the companies that you are contracted and certified to sell as a broker. So this is the homepage of a broker, of an agent. Right here, you can search for clients that you have worked with before in here, and they will be shown. But now we'll go ahead and create a new profile. We have a new client. We enter the zip code of the client. First name, last name. Date of birth. Email address. I just put down the address that I use. And the phone number. Make sure that you provide all the information correct, because once you go into the plans, the information gets pre-populated everywhere from this profile. So we have the address here, city, and the state. And also it asks if the sales contact is different from the beneficiary. We say no. Save. So we save the profile, and once it is saved, you see a few options in here, but you can also see below the agent's name, there is the name of the client. So you can always go right there and see what you have to complete in order to get the enrollment into the plan. So we created the profile, and next step, we'll do the scope of appointment. It's very important to start with the scope of appointment because the website has a timestamp. We email the scope of appointment to the client. It has been sent. And we go ahead and check if we have received it. So it's right here. Scope of appointment form. So it should be scope of appointment. So this is how it looks like. The client clicks on complete scope of appointment form, fills out very easy one-page form with basic information. It asks if the discussion with the client will be about standalone Medicare prescription drug or Medicare Advantage plan plus the cost plans. The Medicare supplement plans do not usually ask for scope of appointment. So we go ahead and click on Medicare Advantage plan for this demonstration and fill out the information of the client. Because it is in my computer, it is pre-populating the information, but the client should enter all this information. You can always sit down with them and guide them how to work with this. So the zip code, phone number is optional. Are you the authorized representative acting on behalf of the beneficiary? Is no, because there should be a legal person authorized to make discussion on behalf of beneficiary to be called an authorized representative. So the beneficiary is working here herself. The scope of appointment has been submitted. And once the agent refreshes the page, he sees that the client Gula completed the scope of appointment. But the agent should countersign the scope of appointment and phone number, what was discussed, the date appointment has been completed, and the initial method of contact is the inbound call. So that's it. So the client submitted scope of appointment on her side, and the agent submitted it and signed it, countersigned on his side. Now the scope is available in here. You can view it, you can upload it, and you can save it in your computer. So we finished the second step. Now we go to the preferences and enter the information that the client provided us. The client wants medical and prescription drug plan. And if it asks, do you receive extra help paying for prescription drugs? You have to ask the client what they receive. In this case, we have no, I am not eligible, because whenever they receive any assistance and you click on it, it asks more information about that assistance, and then it will adjust the plans to the assistance. The premium of the plans, the co-payments of the plans will be adjusted. The client is generally healthy. So here we look for the provider. The client has a provider she's working with, and we have Carrie Bowler, add provider, and set provider as a PCP. Continue. Next will be the prescriptions that the client give us that they use. So let's enter and see what we get. Synthroid, it's right here. It shows this dosage, quantity, and frequency. Would you like to use a generic? You usually say yes. The second is Artovas 13, and it's right here. It does not have a generic substitute. You say yes. And the third one that the client gave us is metformin. So you can always adjust the quantity, but usually it gives us what the providers usually prescribe. So the system knows that. All right, so we have all the prescriptions in here. Now it will take us to the list of pharmacies that we can choose from, that the client can use. So say we go to the Rite Aid pharmacy, add the pharmacy. The pharmacy has been added, continue. So here we get all the plans, and we have to make sure that the premium is low, so it's a zero premium plan, and the provider accepts it, the prescriptions are covered, the Rite Aid pharmacy is in network, and the total estimated cost, including estimated drug cost, is $351. We'll look at a few of these plans and compare them. And see here, provider does not accept. We'll skip this. We don't need the plan that the provider does not accept. And next would be Humana, also zero premium. The total estimated cost is $483 and the drug cost is $36. The drug cost is lower than the ARP, but the total price is a little higher. And the third one, let's see, would be, say, Aetna. So we go with this, we compare these three plans. You see all these three plans side by side. All the details of the plans are here. The cost, the co-payments. You send a quote to the client, the list of the plans. Please review this quote. Let me know if you have any questions. It has been sent. The client looks through it and decides that AARP doesn't really work. She wants to compare Humana and Aetna. You can always edit by deleting a plan, adding a new plan to this plan comparison, and you can send a new quote. So the person looks through this, and we see that Aetna has dental option that you can add dental, but Humana does not have. So the client is considering to add dental to her Medicare Advantage plus prescription drug plan. We look at the plan details for Aetna. So we see all the details of the plan, the co-payments, ambulance, transportation, you name it. So it has all the details. And you can also see the prescriptions, what tier they're in, the quantities, and if the pro authorization is needed. All three prescriptions are in tier 1, and the total cost, which gives you the breakdown of the monthly cost for the client. So it has a drug cost plus health cost and plus premium, which is 0 in this case. So everything is good. It looks good. We add it to cart. If the client wants the dental, you can add dental. So it has two options how you will be completing this form. Send to beneficiary to sign and submit. Or if the beneficiary is sitting right there, the client is with you, then you can complete and submit for myself. So we'll complete the form and send it for signature to the beneficiary. It will redirect us to the Aetna, to the carrier's website. There is few information we have to put in, and the client should sign before we submit the application. Do you have a separate mailing address? No. So it asks the personal information of the client, the residential address of the client, and the primary care physician's name. So we have Kerry Bowler. When we look for the provider ID, you can always look it up by clicking on Find a Physician, which will go again to the carrier's website. 2021 Medicare plan. Location is Brooklyn, New York. Select plan to find providers. We have Medicare Advantage with prescription drug. It is Aetna Medicare Value Plan Medical. Continue to find care. And we have client told us that she works with Kerry Bowler. Here you have it. So the provider ID, just copy from here. Put it right there. It's always good to put the provider ID because if you don't have this information, sometimes the enrollment is not completed and the carrier gives you a call back because they can't find the provider, etc. So it's always good to put all the information in. Are you an existing patient? Yes. All right, so a few more questions about prescription drug. If have other prescription drug coverage in addition to this? No. If they have long-term care? No. If they have a Medicaid? No. If they have any other coverage since they became eligible for Medicare? No. And the language they want to use is English. And this will take us to the last page where it will ask for the Medicare card number, the dates that Part A and Part B are effective, and it will ask how the client wants to pay the plan premium. You might want to use always a Social Security income because it's a zero premium plan and they don't pay anything anyway. But if you use the bank account, the electronic fund transfer, then you have to enter this information, the bank information, the credit card information, but it's a zero premium plan. So we go ahead and do Social Security. And that's it. So it will not take us next because we haven't submitted the Medicare card number, but it's pretty much, as you see, all the information that is needed in order to send it to the client to review, to sign, and submit. So once we click the submission after the signature of the client, the enrollment is completed. And that's about it. It's very easy and straightforward. If you have any questions, always feel free to give us a call, 347-971-3399. You can also email artashevsky@essentialcare.info. And if you don't have your username and password, also contact us. We'll provide you with the username and password. We appreciate your time and thank you very much.